Good afternoon. My name is Dr. Jennifer Warren. I'm the Executive Director of the Center for African American Health Disparities, Education, and Research. It gives me great pleasure to present today. I'm humbled by the invitation and research award and want to thank the organizing committee for seeing the contributions of this important work. While I was PI on this project, it would not be possible without a research team, and few are noted on this article, and that's Dr. Kurlander, Dr. Soire, and Ms. Williams. Their affiliations are below. Today, I'm here to present on the article that received such a prestigious honor. My presentation is entitled, "We Have a Role to Play, American Sierra Leoneans Communicating the Impact of Ebola Virus Locally and Across the Diaspora." This study was funded by the Rutgers Research Council. Support was provided by the Robert Wood Johnson University Hospital Community Outreach and the Center for African American Health Disparities, Education, and Research. None of the authors, presenters have any financial conflicts of interest or political affiliations. This study was carried out in collaboration with the Sierra Leonean community in Greater Agenda. I'm going to go a little bit over Ebola. Study aims, methods, findings, conclusions, and implications. Ebola. Ebola virus is the deadliest and most feared of the viral hemorrhagic fevers that are transmitted through infected bodily fluids. In 2013 to 2016, the Ebola breakout in West Africa was the largest in human history, causing approximately 21,910 deaths, and that's the deaths we know of. The three most effective West African countries were New Guinea, Sierra Leone, and Liberia. Despite increased epidemic surveillance, preparedness, responsiveness, and the availability of experimental vaccines, there continue to be sporadic outbreaks of Ebola virus in Africa, the most recent in 2018 in the Democratic Republic of Congo. This outbreak is considered the second largest Ebola virus epidemic recorded. Ebola virus outbreaks are not just in the infected region. They extend to populations beyond the infected region. Persistent psychological and family ties to one's home country can play a critical role in efforts of international disease outbreaks. Social media and instant messaging maintain streams of bidirectional communication about experiences, food insecurity, financial distress, and health information related to the Ebola virus. However, targeted engagement of diaspora communities outside of West Africa regarding the role they can play in advancing relief efforts or how the Ebola virus has impacted their lives is absent. Study aims. Based on the literature, the aim of this study was to examine New Jersey Sierra Leoneans' experiences, perceptions, and knowledge about the Ebola outbreak to better understand how to serve diaspora communities during disease outbreaks and improve international efforts. The methods. We recruited using flyers and word of mouth. The local Sierra Leonean community helped with the flyer distribution and sharing word of mouth. Eligibility criteria for the projected number of 50 participants included aged 18 to 65 years, to identify as Sierra Leonean, speak English, and reside in the local area. Participants received a $25 Visa gift card as an incentive. 5 focus groups with 4 to 7 participants each were held, 34 participants overall, and moderated by an expert and assistant moderated by an expert. Data saturation, where things were being repeated over and over again, it occurred with 34 participants. And all focus groups were transcribed verbatim using in vivo. We also distributed a demographic survey, which was analyzed using SPSS. So our socio-demographic characteristics. Predominantly male, well, almost split kind of evenly, but more males. More people over 45. Most people had 4 years of college or more. Most were employed, and most had health insurance. So, looking at the qualitative research findings, one of the major categories is stigma and discrimination. Schools were most often cited as a setting of stigma and discrimination, followed by employers and social relations. These were significant findings. Effects in school. One participant noted, "You're already Black. That's already an issue. It's hard to deal with that. As a youth, when everyone else in your class is making fun of you for having Ebola, and your teacher can't stand up for you because she has no information about it either." Effects at work. Participant noted, "I was doing one-on-one home care and went to work, and she sneezed. And the woman she worked for turned to her and said, 'Do you have a cold? Are you sick?' And the woman who was working there said, 'No, I'm not sick. I just have a cold.' And so the woman she was working for said, 'Have you had visitors? Your people come from Africa?' And the worker said no. And so the woman she worked for asked, 'When did you last see them?' So by the time this Sierra Leonean lady, this worker, gets off work, the woman she worked for had called the agency that she was contracted to and told them not to let her come to her house again. And then social relations. There were just so many times of people being discriminated by the public at work, in various places, adults and kids, even outside of school, that it was overwhelming to many of them. And what occurred was many Sierra Leoneans made the decision to silence their Sierra Leonean identity, not to let it come out. So no one knew that they were African or where they were from. They had to do that here in America to maintain their dignity and their jobs. Another category was socio-economic impacts. American Sierra Leoneans provide health education to their families and friends in West Africa. One participant noted, "While me, I have a role to play to educate my family and clan and village from which I come from. They listen to us even more than the government, and that is because the government is not trusted in Sierra Leone." Effects on American Sierra Leoneans. One participant noted, "I have been sending money to them every month because some of them that were doing business, they can't do business now, and they have to live. They have to buy for tomorrow for weekly. It's not like here. We cook and preserve food for the next day because of light. Over there, light electricity is a problem. You can be there 1, 2, 3 weeks, no light, so no food can be preserved." So the Sierra Leoneans who were not receiving food aid were suffering from food insecurity and would reach out to their family members and friends here in America for them to send money because businesses, everything was closed. So not only were the American Sierra Leoneans taking care of their family here, they had to also send money to take care of their family in West Africa. And that's a burden on both sides, the burden of Ebola in Africa and then the financial burden that American Sierra Leoneans had to endure to help their families survive. Knowledge about Ebola. Diaspora communities' information challenges were the most referenced. So these are significant findings too, even more significant than the stigma and discrimination, although those were significant too. But as you can see the numbers here, these challenges were pretty salient for these focus group members. So attitudes toward healthcare facilities. I'm really disappointed the two major hospitals that are in this community. They know we have a lot of Sierra Leonean communities. I was disappointed to see any effort. I didn't see any effort they made towards the community. So where these communities are located is right like 2 minutes from the major hospitals associated with Rutgers. And not one person from the university or the public health agencies or healthcare providers reached out to the Sierra Leonean community, not only to educate them about Ebola, but to address their needs as they were being impacted by the Ebola virus here. Not getting sick per se, although some did, but about the other more social aspects and financial aspects that they were, and the job insecurity that they were enduring during this time. Lack of information and prevention. Another participant noted, if the American media had paid attention to Ebola right at that time, when it was just months into it, many lives could have been saved. And I recall when the first American got Ebola and came back from Africa and was rushed to Emory University Hospital, and it became a big deal. That's when it really became clear via media that there was an Ebola outbreak in Africa and Africans were dying. So this person is very clear and truthful about this issue. And that lack of media attention left Africans to languish and relying on, other efforts that usually show up, international efforts. But as far as educating the American public, it was not there. So study conclusions. The government's not trusted. They're a major source of stress because they don't give out information, and they don't do right by the health of their citizens. And so they serve actually as a barrier to learning about the disease, and they are a barrier to effective and accurate information sharing. Social stigma, discrimination, and financial hardships. There are no national efforts here in America during Ebola to manage the stigma or discrimination faced by Africans here who are impacted by an Ebola outbreak in Africa. And now it has me wondering, what kind of outreach are they doing to Africans here regarding the COVID-19 outbreak, especially those Africans that come from South Africa, where there's a very serious and deadly strain? It's a question. No interventions for youth bullying, no outreach to schools to educate, to ensure African children were safe. Food aid to Sierra Leone was not effective, as families had to take care of not only their family here, but in Africa. Social media was critical in lay information sharing, and we have another article on just that, about the use of social media sharing among these diaspora communities. And health practitioners must consider its value in increasing health literacy during an epidemic. The Sierra Leoneans really relied on WhatsApp application. They have a vibrant community, Sierra Leonean community, American and in West Africa, that communicate regularly, perpetually through social media. So thinking of how health practitioners can play a role in working with key stakeholders in West African communities to disseminate accurate health information and instructions to their family members. Healthcare systems not providing. There needs to be greater coordination efforts to disseminate health information across, within, and external to healthcare systems. It's absolutely necessary. When a whole community can just be marginalized or just go missing in America who face the outcomes and implications of a major deadly outbreak is unimaginable. And they're community health workers who are crucial in the Sierra Leonean community, who are crucial to coordinated community-based efforts. They weren't even tapped into to provide information through social media to families and friends living in Africa, or to address issues of stigma and discrimination, or to address the financial burden that is placed on the families and the work issues. So greater communication and coordination across health systems and other types of systems, division of labor, civil rights organizations, because if they're a citizen of America, to be fired from your job because you're suspected of having Ebola because you're African is a form of discrimination in and of itself, and it's protected, and you are protected under law. Implication. This study demonstrates the expectations and responsibilities that diaspora communities have to support family and friends in many domains, including educational, financial, emotional, and as providers of resources, such as food. Definitely food. Further outbreaks should explore our findings because it makes sense that family members can educate others in their communities using social media apps. And that education might be perceived as more effective and be heard by the individuals who need to hear it, as opposed to health practitioners telling Africans what to do. So drawing on the strengths of these communities is very, very important, especially when it comes to sharing and disseminating information. And they are underutilized in international efforts. And their self-initiated contributions can be much more effective, as I just discussed. By effectively engaging and supporting diaspora communities as well as locally affected communities during an international disease outbreak, international aid can be better directed and used. Clearly, people were not receiving food because family members were calling home to America, telling their family and friends that they don't have food and they don't have money because they couldn't work. So there's something that is serving as a barrier or obstacle to getting to every person who needs food relief and financial relief, if that was part of the package, in West Africa. So maybe this study can teach some lessons, even now during COVID-19, especially with vaccination hesitancy. Think about how social media, in interacting with major community leaders and community leaders telling people about the vaccine, how important it is, its efficacy, and that they got the vaccine, giving them the messages to give to their family members might reduce that vaccination hesitancy and increase vaccination uptake among Black Americans here in America. So there is something mined from this information that is important to COVID-19. Family is vitally important in sharing and disseminating information. I want to acknowledge the research team. I first want to give a special thanks out to Mr. Lamin Al-Harazim. He was like the major player in helping the study get off the ground and to flow effectively and to be completed. He was key in that. Community members who participated in the project as participants, the East Franklin Firehouse in Somerset, New Jersey, who allowed us space to collect qualitative data during focus groups, Miriam Merced, director of the Robert Wood Johnson University Hospital Health Promotions Office, Andrew Thompson, the Assistant Director of Hospital-Based Providers at Robert Wood Johnson University Hospital. And then you know who I am. And these are just some other people. Excuse me. Research Team Assistant and Advisor Peter Granaccia, and Research Team Assistant Wajiha Ansari. And that's the end of my presentation today. I hope it was helpful. I hope it provided information that might be useful to you. And this is critical work, and we need to look more into the role of family and community stakeholders as a means to educate their constituents about various diseases that have the potential to be devastating. Crisis communication, as it would be called. So we need to look more into that as health practitioners, as public health advocates, as community-based nonprofit organizations,